Nisha, and welcome to Are You Smarter Than a Nursing Student? Today we'll be discussing endocarditis and Lyme disease. My partner Kendall is out in the field right now trying to see if anybody knows what it really is. Let's go to Kendall and see if she found what's up.
Thanks, Nisha. So I'm about to go out and randomly select people to interview and see if they actually know what endocarditis is about. So get a look.
Bacteria and other pathogens constantly enter your bloodstream. From sites of infection, injuries, the mucous membranes, and even while you brush your teeth. Bacteria are a danger to the inner lining of the heart, the endocardium, and the heart valves. They can cause destruction, abscess, perforation, heart failure, uncontrolled infection, and eventually death.
I have no idea. What does it mean?
What do you think it means?
I have no idea. Something about cardiology?
I don't know.
The heart? I don't know.
Well, what do you think would be the causes of it, the symptoms?
I don't know what it is. I have no clue what to ask. I have no idea.
Endocarditis. I don't know. Does it have something to do with the heart? Can you take a guess?
Endo.
You're smarter.
I don't know.
I don't know.
It's an itis of some sort.
Endocarditis. That has something to do with the heart.
What are the causes for it?
Heck, I don't know.
You want to try and take a guess?
Cholesterol.
Cholesterol?
That's good. Cholesterol.
Is that your final answer?
That's our final answer.
Okay.
Endocarditis would maybe be an infection of your butt or an infection of your eye, maybe. I honestly don't know what endocarditis would be.
I have no clue what endocarditis is.
Can you take a guess?
I'm guessing it's inside, and it's like a chronic disease that goes on unless treated. But I would have no clue since it's itis. I know it's a disease, but I don't know. Can you tell me?
So after asking the questions on endocarditis, I realized that most people understood that endocarditis had something to do with the heart. But asking them symptoms and causes of endocarditis, they couldn't tell me everything. So I'm going to give it back to you now, Nisha.
Though Kendall couldn't find anybody who knew what it really meant, I'm here to tell you today what endocarditis is all about. Today we will be discussing what is endocarditis, facts of endocarditis, causes of endocarditis, symptoms of endocarditis, risk for developing endocarditis, diagnosis of endocarditis, and the treatment of endocarditis. Endocarditis is an infection of the inner lining of the heart chambers and valves. This lining is called the endocardium. The condition also is called infective endocarditis. The term endocarditis also is used to describe an inflammation of the endocardium due to other conditions. Endocarditis occurs if bacteria, fungi, or other germs invade your bloodstream and attach to abnormal areas of your heart. The infection can damage your heart and cause serious and sometimes fatal complications. Endocarditis can develop quickly or slowly. It depends on what type of germ is causing it and whether or not there is an underlying heart problem. When endocarditis develops quickly, it's called acute infective endocarditis. When it develops slowly, it's called subacute infective endocarditis. Every year, there are approximately 15,000 new cases of endocarditis diagnosed each year in the United States. It accounts for about 1 in 1,000 admissions to the hospital. For some reason, endocarditis is more common in men than women, which is probably attributed to increasing age. Streptococcus aureus is the causative agent in half of all endocarditis cases. Endocarditis is caused by a growth of bacteria on one of the heart valves. leading to infected masses called vegetation. Infection may be introduced during brief periods of having bacteria in the bloodstream, such as after dental work, colonoscopy, and other similar procedures. Patients with endocarditis can develop fever, fatigue, chills, weakness, aching joints and muscles, night sweats, edema, which is fluid collection typically found in the legs, the feet, and the abdomen, malaise, shortness of breath, and occasionally scattered small skin lesions. One of the central risk factors for developing endocarditis is structural heart disease, as it results in turbulent blood flow. About 75% of patients who develop endocarditis have underlying structural heart disease. The presence of a prosthetic cardiac valve is a strong risk factor for endocarditis as well. The risk is highest in the first year after valve implantation. Other risk factors include those who have had endocarditis in the past, implanted heart devices such as pacemakers or implantable cardioverter defibrillators, or ICDs, hemodialysis or central venous catheter, abnormal or damaged heart valves due to an artificial heart valve, a congenital heart defect, injection of illegal drugs, the using of dirty needles or without cleaning the skin, and lastly, HIV. Endocarditis is not a disease that is easily treated, simply because the manifestation of symptoms is different in each person. However, endocarditis is typically confirmed via echocardiogram. There are two types of echocardiogram commonly used to diagnose endocarditis. The first type is transthoracic echocardiogram. In this process, gel is applied to the skin on the chest, and the transducer that emits ultrasound waves is moved down on the outside of the chest. Ultrasound waves bounce off the heart, and the computer converts them into pictures. Doctors examine the pictures for vegetation, areas of infected tissues, and signs of heart damage. The second kind of echocardiogram is transesophageal echocardiogram. In this process, a long narrow tube with a transducer at the end is passed down the esophagus. This method is highly effective because the esophagus is posterior to the heart, allowing for a great picture. The last way that endocarditis is diagnosed is through serum bacterial cultures. Blood is drawn several times over the span of 24 hours and put into culture bottles. Bacteria are identified and tested to see which antibiotics kill them. Culture-negative endocarditis occurs when blood cultures don't grow bacteria but still require antibiotic treatment. Endocarditis is easily treated with the use of antibiotics. For 2 to 6 weeks, antibiotics are administered to the patient intravenously. Hospitalization is necessary the first week or so to ensure the medicine is actually helping. In extreme cases, due to excessive damage, surgery may be needed to sometimes repair or replace damaged heart valve or clear up other endocarditis-related issues. With proper treatment, endocarditis is a highly curable disease, with about a 90% recovery rate with antibiotic treatment. However, if it is left untreated, it can be fatal. The worst kind of endocarditis is fungal endocarditis. The best kind of endocarditis to have and the possibilities of recovering from is right-sided endocarditis. This is because patients with right-sided endocarditis are typically younger, with fewer comorbid medical conditions and less underlying valve diseases than patients with left-sided endocarditis. Additionally, the mortality rate among patients with right-sided endocarditis is typically less than 10%.
Now that everybody knows exactly what endocarditis is, I'm going to do the exact experiment on people and see if they know what Lyme disease is.
For nearly 5 years, Brittany Goff suffered at the hands of a mysterious illness that left her chronically fatigued and in constant pain. But after being diagnosed with Lyme disease, she thought she'd found an answer to her health problems. Now, 2 years after that diagnosis, the 20-year-old's condition is becoming intolerable.
I told myself if the pain gets worse, I just didn't even want to live anymore.
At the end of her rope, Brittany makes a last-ditch appointment with Dr. Daniel Joller.
Her symptoms were compatible with a diagnosis of chronic Lyme disease. but I began to suspect there might be something else going on in addition to Lyme disease.
Dr. Joller orders a series of blood tests to confirm his hunch. 1 month later, Brittany and Patty get the results.
Brittany's test results, it showed that not only did she have persistent Lyme disease, but also confirmed that she was suffering also from babesiosis.
I had never heard of babesiosis before in my life. I was completely shocked.
Babesiosis is caused by a protozoan parasite called Babesia microti. When a person's infected, the parasite targets red blood cells, which transport oxygen throughout the body, and that can cause numerous problems for the host.
Inside Brittany's bloodstream, the Babesia parasites continue to invade red blood cells, where they feed and reproduce. Eventually, the parasites destroy the red blood cells, flooding the body with their offspring. As the Babesia parasites wipe out the cells, Brittany's oxygen levels decrease, resulting in extreme fatigue.
It was very frightening and scary to know that I've had a parasite living in my body for the past 8 years and I didn't even know it.
In many cases, those infected don't experience any symptoms because their spleen is able to remove the infected cells from the blood. But when the body's immune system is compromised by another condition such as Lyme disease, the spleen can become overworked and the Babesia parasite takes hold. If that happens, the consequences can be dire.
What are the symptoms? Mm-hmm. You get tired. Well, my client has Lyme disease. If you attach your immune system, right? Maybe. I know it affects your immune system. I don't know. I don't know the rest of them. Okay.
I don't know.
Yes.
I don't know.
You don't even want to guess?
No.
Take a guess.
Where people eat limes or something?
Is that your final answer?
Sure.
Okay.
The tick?
Yeah, so, okay, so what are the symptoms?
Yeah, I can There's a spot.
I'm gonna guess that something to do with blood.
Blood?
Yeah, it's your blood. I don't know. I
Okay.
don't know anybody with it.
Okay, so Lyme disease wasn't that much easier. A lot of people guessed ticks, but a lot of people guessed that it was an infection that was done by Lyme. So I'm here to tell you now exactly what Lyme disease is all about. Today with Lyme disease, we're going to talk about what is Lyme disease, symptoms of Lyme disease, how Lyme disease is diagnosed, the risks of developing Lyme disease, treatment of Lyme disease, and the prognosis of Lyme disease. Lyme disease is a bacterial infection that is spread through the bite of one of several types of ticks. It is a bacterial infection caused by the bacterium called spirochetes. The real name of the bacterium is Borrelia burgdorferi. Lyme disease is not contagious. Lyme disease was first reported in the United States in the old town of Old Lyme, Connecticut in 1977. The same disease occurs in many parts of Europe and Asia. In the United States, most Lyme disease infections occur in the following areas: northeastern states from Virginia to Maine, north central states, mostly in Wisconsin and Minnesota, and west coast, particularly northern California. Black-legged ticks and other species of ticks can carry these bacteria. The ticks pick up the bacteria when they bite mice or deer that are infected with Borrelia burgdorferi. You can get the disease if you're bitten by an infected tick. There are 3 stages of Lyme disease. Stage 1 is called early localized Lyme disease. The infection has not yet spread throughout the body. Stage 2 is called early disseminated Lyme disease. The bacteria have begun to spread throughout the body. Stage 3 is called late disseminated Lyme disease. The bacteria has spread throughout the body. Symptoms of early localized Lyme disease, Stage 1, begin days or weeks after infection. They are similar to the flu and may include chills, fever, general ill feelings, headache, joint pain, muscle pain, and stiff neck. There may be a bullseye rash, a flat or slightly raised red spot at the site of the tick bite. Often there is a clear area in the center. It can be large and expanding in size. This rash is called erythema migraine. Without treatment, it can last 4 weeks or longer. Symptoms may come and go. Untreated, Lyme disease can spread to the brain, heart, and joints. Symptoms of early disseminated Lyme disease, Stage 2, may occur weeks to months after the tick bite and may include numbness or pain in the nerve area, paralysis or weakness in the muscles of the face, heart problems such as skipped heartbeat, chest pain, or shortness of breath. Symptoms of late disseminated Lyme disease, Stage 3, can occur months or years after the infection. The most common symptoms are muscle and joint pain. Other symptoms may include abnormal muscle movement, joint swelling, muscle weakness, numbness and tingling, speech problems, and thinking problems. Doing outside activities that increase tick exposure, for example, gardening, hunting, or hiking, in an area where Lyme disease is known to occur. Having a pet that may carry ticks home, and walking in high grasses. A blood test can be done to check for antibodies in the bacteria that cause Lyme disease. The most commonly used is the ELISA for Lyme disease test. An immunoblot test is done to confirm ELISA results. Other tests that may be done when the infection has spread include electrocardiograms, echocardiogram to look at the heart, MRI of the brain, and spinal tap, lumbar puncture to examine spinal fluid. Antibiotics, 2 to 4 week course. Choice of antibiotics depends on the stage of the disease and symptoms. Doxycycline, amoxicillin. Those with neurological, cardiac forms of illness may require IV treatment with antibiotics. Anti-inflammatory, PTLDS, post-treatment Lyme disease syndrome. Chronic joint inflammation, especially in the knees, neurological symptoms, facial palsy, neuropathy, cognitive defects, diminished memory, and heart rhythm irregularities. If diagnosed early, Lyme disease can be cured with antibiotics. Well, that's all today for Are You Smarter Than a Nursing Student? Signing off, this is Nisha. And Kendall. Bye!